Hello, my name is Dr. Michael Smith, and welcome to my website,
Autoimmune Health Solutions.
In my clinical practice, I primarily focus on autoimmune disease, post-traumatic stress disorder, and addiction. I've been in practice for almost 25 years, and I've found that a combination or an integration of things like functional medicine, ancestral nutrition, the vast wisdom and experience of traditional Chinese medicine, the common sense of embodied awareness, trauma release practices, meditation and breathwork, all come together depending on the needs of each person to create a really complete model of care. I practice this way because I have a theory. It's based on my experience as a clinician and my experience as a patient. When you look at the biochemistry of stress physiology, of chronic inflammation, of being in chronic pain, of feeling tired and having to push through all of that, the physiology and chemistry of that is what you would see in an autoimmune disease patient. It's also what you would see in a person suffering from complex trauma. And it's also what you would see if you were looking at a person dealing with chronic substance abuse and addiction. Now, I'm not saying these are all the same condition medically, at least in a diagnostic sense. I'm just saying that when you look inside the inner makeup of the physiology of the body, the inner experience of inner turmoil and distress, they all actually look very similar under a microscope, and much more importantly, when I meet people one-on-one every day in my practice, they look very similar sitting across my desk having a conversation. Imagine that for a moment. Just think about that. The inner chemistry, the inner experience, the embodied experience, the mental experience, the emotional experience of people with autoimmune disease, complex trauma, and addiction are almost sharing the same life, at least in some ways. So when it comes to resolving the biochemical part of this, I usually focused mostly on a combination of functional medicine lab testing, therapeutic diet protocols, supplementation protocols, and the very individualized and very accurate application of traditional Chinese medicinal herbs, therapeutic exercise, and of course, acupuncture. When it comes to working with people on an individual, personal, or subjective experience level, that's when I focus the most on things like mindfulness practice, breathwork practice, and what I call somatic mindfulness process, which is a form of therapy, but it's also a form of daily practice. It gives people an opportunity to reorient themselves to their inner experience, to their sense of purpose and commitment. Because in a way it doesn't matter if you have a diagnosis that says colitis or arthritis, or if it says that you have PTSD, or if you're aware that you need treatment for addiction. What really matters is that each person feels that they have the resources, the tools, the confidence, and the patience to put all of these things into practice. It's not easy being a complex chronic illness patient in any way. And it's not easy, unfortunately, for most of your clinicians to help you in every way that you actually need help. As I said, I'm a patient as well. I've been diagnosed with Crohn's disease, ulcerative colitis, a complex connective tissue autoimmune disorder. They haven't really decided exactly what it is yet, as well as complex PTSD. In the past, I've also had some addictive issues. So again, I'm very familiar with what it's like to reorient yourself from the inside out, to find the skills and the tools and the resources and the connections and the care that I have needed, that you may need, to kind of rearrange your life again and start from scratch and figure out how to live your best life with that kind of a challenging diagnosis.